Hey guys, Dr. Ben here. Welcome. I'm going to talk about you today, you, loved one, anybody else, and that you're so much more than just a diagnosis. We have all been labeled certain things in our life, whether that's in the medical model, as a kid. I was probably labeled ADD as I was a kid, even before they called it ADD. We've got labels, we've got stickers we'll slap on people, all these things. But I want to tell you, you are more than a diagnosis, much more than that, and your body is much more complex than to say you have this or this or this or this symptom defines you. So welcome everybody. Pop down below where you're watching from. Love to see you guys all over the country, all over the world. Also, there's a little button up in the corner Facebook keeps reminding me about. Tell you guys, hit that button and there's a little bell, like a ring-a-ding-ding bell, and hit that and it will tell you when we go live multiple times a week. Just like tomorrow, we're going to be going live talking about live Q&A, so question and answer. Bring those questions. I'll bring whatever answers I've got in me, and we'll just learn and help as many people as we can. So this is what I want to go over today. So many of you, give me a thumbs up out there. How many of you guys have been diagnosed with something, labeled with something, gone to multiple practitioners and been labeled with multiple things, and you're still kind of confused? A lot of people are out there like this, where it's just like, oh my gosh, I've been to this specialist, and they referred me to that next one, and that GI doctor doesn't know what it is, so then they send me to the endocrinologist, and you just get bounced around from person to person. We see this all the time with patients. There's some thumbs coming up there. So here's the deal. Many people in their health journey have been diagnosed with something. They've been diagnosed with an autoimmune condition. They've been diagnosed with Lyme disease, or they've had a moldy house, or they've been diagnosed with a chronic irritable bowel, or fibromyalgia, or chronic fatigue syndrome, all these different things. But what those diagnoses tell us, hey, Carrie up in Minnesota, great to see you. What those diagnoses tell us is basically that, that this person has X, Y, or Z symptoms, but it doesn't tell us what the problem is. So think about it. I love picturing it this way. You could have 10 people that have Hashimoto's, autoimmune thyroid, and every single one of them have different whys. So their diagnosis is all the same, but their whys are different. So think about this. We have, thanks Christy for the stars, appreciate it. We have low blood sugar in one person and high blood sugar in another person. We have viral infection in one, bacterial infection in another. We have low iron in one, high iron in another person. So if you look at it that way, the same diagnosis can have many different causes. And on the flip side of that coin is you could have 10 people with the exact same blood work that have the exact same viral, low blood sugar, insulin resistance, whatever it is, and yet they come out and they express themselves differently. One could be 100 pounds overweight. The other could be very inflamed and pain. The other could have autoimmune conditions. Somebody else could be having 30 bowel movements a day. All of these different things. And so this is what we need to get to. And when you're thinking about you, a loved one, anybody else in your life, and their true health care, not the sick care model that we live in, where people are continuously driven down this path of more drugs, more surgery, all of these things to cover up the symptoms. We don't want to cover up symptoms. I mean, obviously we want symptoms to go away, but if you're just covering up that symptom and you stop taking that drug, you stop taking that supplement, you stop doing whatever it is that's changing that symptom and it comes back, you fixed nothing. And that's what you have to look at. When you're thinking about healthcare, when you're thinking about changing somebody's life, it is so much more than a diagnosis. And the diagnosis, they fly around like crazy. If anybody's in the healthcare field, give me a thumbs up if you're in the healthcare field and you've looked at the ICD-10 codes and all these different things. There's ones where you can get sucked into the propeller of an airplane, and that's a diagnosis code. It's just crazy. So many different ways that we can label and diagnose people, but we're not truly getting into the scientific community. And that's what I want you guys to think about. True science. There's people out there in the government, in the medical field, that they say, I represent science. I am science. If you go against what I say, you're going against science. And I want to tell you that true science is continually questioning. Both of my parents were science teachers, and I guarantee you this, the things that they taught 40 years ago in science are absolutely different than they are today. Sure, there's some foundational pieces, but there's a lot of changes, a lot of things that have been discovered. If you've got a PDR, a physician's desk reference, tells you side effects and all these things of every drug out there, it's this big book. If you've got one from 7 years ago, they tell you, get rid of that book because that information is obsolete. So think about that. 7 years ago, that information was cutting edge. It was exactly where you needed to be, what you need to be taken, how you need to be prescribing that drug, what you had to look for with side effects. But if it's 7 years old, now that information is obsolete. You could be harming people. So think about that. What was going on 7 years ago was the same thing. It was still a guess. It was still potentially harming people. And that's where we've always got to be questioning. We've always got to be moving forward. And so many people that we see have been labeled and gone down this path and thrown from one practitioner to another, labeled with this, labeled with that. Okay, this is how we treat these symptoms as opposed to treating these systems. And that is what true healthcare is about, is getting to the underlying root causes of why somebody is having those issues. So again, I'm going to tell you to question everything. Question, if you go to your doctor and you get prescribed a medication, blood pressure medication or cholesterol medication or any of these things, ask these questions. Write these down. Ask these questions. You need to ask, how long am I going to be on this drug? You know, I think that's a really rational question there. Is it somebody with cholesterol and they go, well, you'll probably need to be on it forever. And then you're like, you're not fixing anything. So ask how long, and ask what is the goal of being on this medication. So what are we going for? What are we looking for? Is it a short-term thing to get down inflammation? Is it to kill off bad bacteria really quickly and then we can make some changes? What is the goal of being on that medication? What are potential side effects? And if they don't know or say, oh, you'll be fine, you need to get a new doctor, because I guarantee you every single medication that you're taking out there is going to be potential side effects. Even a cholesterol medication. People, I guarantee you there's somebody watching right now that's taken cholesterol medication and they've gotten leg pain, they've gotten some type of nerve irritation, they've gotten yucky feelings from taking a cholesterol medication. There's even these simple benign medications that we think don't have major side effects can have side effects. So you need to know. Ask the doctor, ask the pharmacist. You've got to, if they don't know, then you've got to check on Google and look for all those, and then look into even support groups where they talk about the different medications, things like that. And so then you want to go ask the doctor, you know, is this my best course of treatment? Is this the best thing that you've got for me? If my cholesterol's high, is this the best thing? Say, I'm willing to do whatever it takes. What is the best course of treatment? And if they still say just taking a cholesterol medication to lower your cholesterol is the best course of treatment, you need to find another doctor as well, because there is so many other things going on besides just a lack of cholesterol medication. And I'm just using this as the example. It could be any condition that you're dealing with. Is this the best course of treatment? And if somebody says, you know, that if you've got a gut issue, a GI, a digestion issue, and they say diet doesn't matter, again, time to find a new doctor. This is not going to get you fixed to say, yeah, it doesn't matter what you put in your mouth. So here's some thoughts that I have, and these are some things that that I want you to get rid of. These thought patterns, get rid of these thoughts, replace these with other things, with positive things. I want you to get rid of the thought that whatever you or a loved one is dealing with is incurable. Get rid of that thought of that disease is incurable. I've seen my mom heal from MS. I've seen my wife heal from Lyme disease, heal from autoimmune to the brain. We've seen patients for years and years heal from diabetes, from all types of different things. Never say never. A disease is never incurable. Get that thought out of your head. Get out the thought that this is only get worse and worse and worse. You've got to get that out of your head. There is a very good likely it can get better. That patient, 20 bowel movements a day. He's now going once a day. He's lost 40 pounds. He feels great. He's 23 years old. He's ready to take on the world. There is nothing saying that every condition has to get worse and worse. And I want you to get this out of your head. The only answer is drugs and surgery. So get that out of your head. There's always something else that can be done besides a drug and surgery. Sure, occasionally somebody needs to go on an antibiotic for an infection in their foot, and it's gangrene and whatever it is. You've got to do what you got to do short term, but that is not the only answer. There is always more information, more things to go down that path. Get this out of your head. Diet doesn't matter. If you've been to a GI doc, if you've been to a specialist, endocrinologist, any of these things, you ask them, oh, I've got thyroid, should I stay off of gluten? And they go, that doesn't matter. Here's what I want to tell you. Diet does matter. What you're putting in your mouth is the most important thing that you can do today for your health and to keep your body as vibrant as possible. Here's the other thing. Disease is not simple. Disease is not as simple as A plus B equals C. So if you have A and B, you get C, here's the medication for that. That is a simplistic approach. It is something that is not going to give you the answers, and it is ultimately harming the body because you're missing out on so many things. Disease is not a simplistic that you just plug and play this for that. You've got this diagnosis, you take that. Even supplement, even natural things are not going to be getting you where you need to be. And then the last thing I want you to get out of your head is that it's all in your head. Here's the deal. You may be a little bit crazy. I'm a little bit crazy. We're all a little bit off kilter, but here's the deal. What you're dealing with is not all in your head. You're not making it up. You're not creating this out of the blue. There are physiological reasons why you're having these symptoms like you are. If you're not getting the answers you need, give us a holler. We've got our office in Brentwood, Tennessee. We're opening up in Hendersonville, North Nashville. Hey, Christy, thank you. We've got our Fort Collins location going to be opening up in South Denver in January. I don't know if I've officially announced that yet, but we'll be opening up in January, South Denver, and we work with patients all over the country. So any of those locations, get a hold of us. We can get you in touch with people that are going to think outside of that diagnosis box and get you into the box of true healing, getting to that root cause. So love having you guys on. I'm just inspired today to go over this. I've heard it so many times recently that I'm just this diagnosis. It's all in my head, all those things. And you are much more than that. You are a very complex self-healing mechanism, and you were designed to be as optimal as you possibly can. So, all right. So be well, guys. Stay strong. Keep your bodies as vibrant as possible. Love having you on. Take care.